Welcome, Sonoma Valley, to today's community town hall. We are going to be focusing on the COVID-19, as Dr. Kidd calls this is the vaccine edition. I want to give you a little bit of background on Dr. Kidd. She is our Chief Medical Officer and also the UCSF, which is University of California, San Francisco Medical Director for Sonoma Valley Hospital. She is a dual board certified physician. She is a colorectal surgeon and a general surgeon. And if that's not enough, she also works with a nonprofit group in the Bay Area known as Operation Access. She is a brilliant individual. We're glad that she is on board on our team. We're also glad that she's heading today's presentation. And let's just cut to the chase and get into it. Without further ado, welcome and take it away, Dr. Kidd.
Thank you, Celia, for that warm introduction, and welcome to all of you all. I can see that there's quite a number who have joined us today, so I hope this will be informative and that we will be able to answer many of the outstanding questions out there. I'll give you first here a little overview about what we plan to cover, and then we'll jump right into it. So just to briefly touch on our current state of COVID-19 so we can help understand where we're at as we're attempting to distribute these vaccines, and also give us just why we need this so badly right now. Then we'll jump right into the vaccine itself. I'd like to walk through the mechanism of action. Although that is scientific, I think it helps us understand why I believe this is a very safe vaccine. And it also helps us understand some of the challenges that we're looking at as we roll out distribution plans. We'll go directly through some of the study findings for both Pfizer and Moderna, and then we'll talk about some of the logistics. Then we'll touch a bit on how it is administered and special considerations for different populations, such as if you've already had COVID, should you still get a vaccine? If you're pregnant, or if you have comorbidities, etc. So we'll try and address some of those. Then I will try to spend some time on distribution phases and what we know now. This is a very, very rapidly changing area, and I will attempt to give you what I have learned as of even up to the last half an hour that's been released locally. So I will fully admit there are a lot more questions than consistent answers around distribution at the moment, but I think that that is rapidly going to change, and we will get everyone vaccinated as soon as absolutely possible. Finally, I will touch on, I just want everybody to be aware of something called a Cal Notify smartphone app to aid us in contact tracing until we no longer have to worry about that. And then finally, we'll take a Q&A for any questions that we have not yet addressed. So jumping right in, I think we all know we are still very much in a national crisis. For these first couple of slides, these snapshots are actually a little over a week old. And any small dip we saw was really related to reporting variations over the holidays, and the numbers are steadily increasing, definitely on a national level. And that is across the board. That's in new cases, that's in deaths, as well as the amount of tests being performed, and unfortunately hospitalizations as well, which is something that I track very closely. So how about California? As you'll see that, and as we all know, California very much avoided what we saw out east early in the pandemic. And even this summer, although we went up, we did not go nearly as far as Arizona and Florida and some of the other states that were really impacted with the summer wave. However, this late fall wave has hit us hard. And it continues. We are not seeing any respite in sight. And although largely the Southern California is worse than Northern California to date, Northern California is not exempt. And here locally in Sonoma County, we are seeing our hospitals get very close to capacity. As of last evening, the official numbers for the Bay Area region ICU capacity had dropped to 0.7%, and Sonoma County was hovering around 6%. Today's numbers have not yet been released to determine whether or not we will be asked to put elective surgeries on hold. So I give that as a background because I think we all know that this vaccine is very welcome, but also very much needed, and also coming at a very challenging time when our hospitals who are being taxed with administering this are stressed with caring for very sick patients. So it's a very challenging time to navigate. So how does this wonderful vaccine work? Well, the two we're going to focus on are the Pfizer and the Moderna vaccine. And we'll keep it simple because those are the two that have what we call EUA approval or emergency use authorization. And they have in common that they're both mRNA vaccines. mRNA is messenger RNA or messenger ribonucleic acid. And what that is, as you'll see on this left most side here, is that RNA is basically instruction material that's housed within a cell, or in this case, the coronavirus. And what you'll see represented is things of the spike protein gene. And that's this little red portion here. And basically that's a code that tells the cell how to make those spikes that we've all heard about that are characteristic of the coronavirus. And so what these researchers have done is that they have isolated the instruction set for just the spike protein, nothing more, nothing that could actually make us sick, just the spike protein that we know adheres to our cells. And then they've taken that and they put it in this, what we see as looks like a purple envelope. This purple envelope is what we call lipid nanoparticles. It protects those instructions, which are very sensitive and unstable. However, that lipid coat is not itself very stable at room temperature. And that's where we'll talk later about the extreme temperatures that come into play in order to make sure that those instructions are delivered in a viable or live fashion to us as recipients so that our bodies can do the next steps. So when that does come to us in this vaccine form, which is just those spike protein instructions, no live vaccine, coated in that purple coat to make sure that those can actually be used, that they're a valid instruction code, that would be injected into us. And what you'll see here is that that would then encounter one of our cells. Our cell would take it in and try to figure out what this is. Well, it would take those instructions and it would say, hey, we're supposed to make spike proteins. So it would make spike proteins and it would put those on the outside of our cell, as you see here. So that's kind of the first step. And then what happens is that our cell actually destroys that instruction set. And then this cell eventually will also be destroyed. And when that host cell is destroyed, tons of spike proteins are released into our body. Those are not harmful to us. They do not cause infection. What they do, though, is they're recognized as foreign and our body wants to attack them. And so there are things that are part of our immune system, and they're called antigen-presenting cells. They will then take in and digest all these little spike proteins that have been made, and they'll go, hey, we need to form a response to this. So they will go and talk to another kind of immune cell that we call a helper T cells. Those are the ones that really raise the alarm bells and alert our whole immune system of, hey, we've got a job here. We got to fight something off. So the helper T cells say, go find our other immune cells. And one of those is a B cell. So a helper T cell that is now armed with this foreign spike protein goes and finds a B cell, which is another immune cell. And B cells are the kind that make antibodies, our friends. So the helper T cell attaches to the B cell and it trains it to make antibodies against that foreign spike protein. So once you get to the B cell phase, that's where you're going to get antibodies. And yes, those are measurable. And yes, those are what can defend us against the actual coronavirus. So what does that look like? So again, if the coronavirus, this thing surrounded with spike proteins, enters our body, if we have antibodies floating around, they will recognize that spike protein, they will connect to it, and they prevent those spike proteins from then connecting to our other healthy cells to cause an actual infection. The spike proteins on the coronavirus are how the coronavirus gets into our bodies. It's what it uses to attach to our healthy cells and then invade and cause replication and disease. So by preventing the attachment phase, it prevents the disease. But what if one slips by the antibodies? Well, don't worry, there's other mechanisms as well that our bodies have for an immune response. And that's that if you remember those antigen-presenting cells, they go to other cells besides the B cells. They also can communicate with something we call an activated killer T cell. The killer T cells actually can go find a cell that has unfortunately been infected and destroy that cell. Same pattern of recognition. They use that spike protein to know what's good versus bad and either prevent it from attaching to our bodies or kill one that has somehow slipped by. So that is an overview of how an mRNA, a messenger RNA vaccine works. Important here, there is no live virus, and that instruction sheet is destroyed once our body learns how to defend against a spike protein. So let's talk about this mechanism of action is something that's been known but never successfully deployed until this vaccine. And both Pfizer and Moderna, which are two vaccine companies, have now brought this to market. So let's talk a little bit about how they did their studies to prove that this actually works. Well, Pfizer had almost 44,000 participants. Moderna had about 30,000, and each of those half received active vaccine and half received placebo or a saline injection. So the individuals were blinded, meaning they did not know, were not told which they received. They each received 2 injections. In Pfizer, it's a 30 microgram or 0.3 ml dose. And for Moderna, it is a 100 microgram or 0.5 ml dose. Both are given IM, which means intramuscularly, the common shot that you get in your arm or leg. And they are given for Pfizer 21 days apart, 3 weeks, or in the case of Moderna, 28 days apart, 4 weeks. In both cases, the endpoint was, meaning they looked at and concluded the study, looked at their data set when 7 days or more had passed after an individual received the second dose. They looked for any infections that occurred after that window. That's very important because when we talk about how well this vaccine works, our data is not based on what happens after the first dose, nor immediately after the second dose. Our data is based on infections that occurred a full week after both doses had been given. So whether or not these can convey any sort of immunity prior to that, we have very limited data and we cannot draw conclusions at this time to what we would say is a partial vaccination status. So let's look a little bit more at what they found. Specifically in the Pfizer study, 180 cases of symptomatic coronavirus were detected and then confirmed with a positive PCR test. Of note, they did not look for asymptomatic cases, meaning there was not routine testing done. Testing was performed on individuals who became symptomatic, and that was then the confirmation that yes, this was a confirmed case. They found 180 cases overall. 8 of those occurred in the vaccine group and 162 in the placebo group. Though using those numbers, that is where you conclude doing the math that the Pfizer vaccine is 95% effective, meaning 95% chance that once you've been immunized, you would not get a symptomatic case of coronavirus. Very, very similar results with Moderna, 94.1% effective, basically the same. So let's look a little bit more about, was this a good study and does it work in older individuals? Because in some cases, vaccines may not work as well because as we age, our immune system may not be as strong as it is when we are born. So in Pfizer, they did include 21.4% of the participants were actually 65 years old or older. In Moderna, it was 25.3% that were at least 65 years old. So these results were obtained, and it does appear just as effective in older individuals as in younger individuals. And these were not, however, as you will see, tested in children. So we cannot speak about children. However, the Pfizer vaccine is approved for 16 years of age and older. The Moderna sought approval for 18 years old and older. Studies have begun on younger age groups, and there's no reason to think it won't be safe or equally effective in younger groups. But this is kind of vaccine or testing protocol in general that we start with adults, and once we've proven it safe, we may move on to children, and that's just more of an ethical principle of protecting our younger children who can't speak for themselves from a study in its initial stages. It was also, for similar reasons, not studied in pregnancy, but as you will see later, and why it was very important to look through that mechanism of action, there's no mechanism to suggest that this would be harmful to pregnancy. And so you'll see what the guidelines are regarding that. But again, we do not have data in pregnant individuals to support that. Again, when you're looking at populations, there's always a question is, does this work equal against all individuals, even though we may have slight genetic variations? With that, we often look at different ethnicities and different populations. Although they attempted to get a somewhat diverse panel in both groups, you will see that nearly 80% across both studies self-identified as white. The next largest group in both self-identified is either Hispanic or Latino, and it goes down from there. So again, although we have no reason to believe based on the mechanism of action that it would act differently in different diverse populations, you can see that both of these studies were heavily weighted to individuals who self-identified as white. And that was largely based, I believe, on volunteers. So we know that these work, meaning that they prevented symptomatic disease, but at what cost? So let's talk about the side effects, the known reactions to occur that do not mean you're getting the coronavirus, but that you may feel ill for a day or two around the time you get it. Well, most commonly reported are local reactions. These mean that at the site you get the injection, usually your arm, that you may have some localized pain, redness, or swelling. And that on average, these occur either immediately or within 2 days after you are given a dose, and they only last 1 to 2 days. Most were very mild. There are a smaller group of people that reported what we call systemic symptoms, meaning they affected their body as a whole, not just the injection site. Fevers were reported, overall feeling of fatigue, headaches, in some cases chills, muscle pain, and joint pain. However, I'd like you to look at the little box that I know might be a slightly blurry to read, blown up from the study itself. This is with the Pfizer vaccine. And if what's really important to notice is that, yes, with dose 1, local reactions, those arm reactions, were reported in 78.6% of people and in 73% of people after their second dose. However, placebo also reported 12.8 and 10.6% respectively. So a significant difference between the placebo and the vaccine for a local site injection. Now let's look at the systemic. Here's where it gets interesting. Note that 47% of people reported a systemic reaction after receiving saline. So again, our minds are very powerful, and yes, there is an increase in reactions, and they are real because 59.1% reported it after receiving the vaccine, so a higher than 47% with the placebo. But look at the amount of increase to really judge the true amount of reaction, which is likely only maybe 15% versus what people perceived after receiving a saline reaction or had a symptom that was true but unrelated to the vaccine itself, if you interpret this data. So definitely they occur, but overall this is a pretty safe and pretty typical pattern for a vaccine and pretty comparable to what we see with a flu vaccine. So let's talk about some more details. We mentioned that purple envelope, that lipid core that contains the mRNA. That is why storage and shipping are challenging. That is what must be kept very cold. In the case of Pfizer, their envelope must be shipped and stored consistently at -94 degrees Fahrenheit. This is ultra cold freezer temperatures. This is dry ice temperatures. This is not something that's widely available, and these sold out midsummer when it was first noted that this vaccine was a front runner. So they're hard to get your hands on. Once thawed, the Pfizer vaccine, so meaning once it's brought from that ultra cold temperature to refrigeration temperature, still must be refrigerated. You have 5 days to use it before it goes bad. Once you open a vial, so going further, and there's 5 doses in a vial, you have 2 hours to use all 5 of those doses or you will waste it and it will no longer be considered usable. Also, with the Pfizer vaccine, these come in fairly large quantities. The pizza box shipment, as it's become known, is a minimum order, meaning that in one shipment is 975 doses, and there are 5 doses per vial. So that's quite large. And when you're looking at mass vaccinations, that seems like not much, but if you're looking at your primary care's office being able to deliver 975 doses through their regular schedule within 5 days and have 5 recipients per every 2 hours, that's very challenging to figure out the logistics. So let's compare that a little bit to the Moderna. It's a little bit easier to work with. That can be shipped and stored at -4 degrees Fahrenheit, which is more of a normal freezer temperature. Once thawed, you have a little bit longer to use it. You have up to 30 days instead of those 5 days to use it at refrigeration temperature. Further, this is room stable for 12 hours, but once the vial is punctured, you only have an hour, and there's 10 doses in this vial. So you need to use 10 doses within 1 hour once you've punctured a vial in order to not waste any vaccine. So again, still easier to use than the Pfizer as far as logistics are concerned, same efficacy, and no, we don't have an option which one do we get as far as allocations at this point. So that's yet to be determined, but overall the Moderna is easier from a logistics standpoint to work with, but absolutely no evidence that it is better or worse in either efficacy or side effect panel than the Pfizer. So how do we give these administration details? Both, as I said before, are 2-dose series, and yes, you must get both doses. I'm aware that overseas and elsewhere, even here, it's being discussed, how much can we get out of 1 dose? And the answer is that is unknown, and that is not yet endorsed. That is not how the emergency use authorization was approved. So sites that are administering this do not have approval to not do a second dose at this time or take that approach officially. Could that change? Of course, I can't see the future, but the data we have at this point does not support that. In the case of the Pfizer, it's 3 weeks apart. In the case of Moderna, it's 4 weeks apart. However, is there wiggle room? The answer is sort of. With Pfizer, they recommend that you have a 4 days grace period, meaning the soonest you can get it is day 17. They recommend between day 17 and 21. If more than 21 days have happened and somehow you missed that second dose, the recommendation is to just give it as soon as possible. And as I said, it is approved for 16 years of age and older, where the Moderna is only 18 years age and older. So there's a 2-year age gap there. The Moderna, just very slightly different. Again, second doses after day 24 or greater. Officially, it's 4 weeks or day 28, but it appears you have that same 4-day grace period. You're not to give it sooner than 17 days for the Pfizer or sooner than the 24 days for the Moderna. So we can't speed up this 2-dose protocol. We are limited by that. And the same as with the Pfizer, if you are overdue, the recommendations are to give it as soon as possible. So as I've said a few times now, both doses from the data that we have, which are those 2 studies, ongoing is being collected, but at this moment, it is that both doses are necessary for protection. Data was not adequately collected to be able to say what the efficacy is after a single dose. So also, due to lack of knowledge of whether or not our immune systems can adequately react to the COVID vaccine and create the necessary immune response if another vaccine was given at the same time, it is recommended to separate this from any other vaccine doses by at least 2 weeks. So as in what we do with children, we often combine vaccine doses of multiple different types of vaccines. That is not at this time recommended. So specifically, if you haven't gotten your flu shot, my personal recommendation would be flu is very low right now. Get your COVID and get your flu later. So the point is to separate those out for sure. And again, at this time, Pfizer and Moderna, even though they have the same mechanism of action, they are not considered to be interchangeable. We have no data. And as you've seen, their doses are slightly different, and that very much could affect the efficacy if these were to be substituted one for the other. So that data is not known at this point. If you start with Pfizer, your second dose needs to be Pfizer. If you start with Moderna, your second dose needs to be Moderna at this time. Again, could that change if we get additional data supporting it? Absolutely, but those are the current recommendations. What if you have already had COVID-19? And do you know this? Do you not? Do you have antibodies? Do you not? Well, here it is. It is indicated regardless of history of prior symptomatic or asymptomatic SARS-CoV-2 infection, that's COVID-19. So there are some caveats about the timing with regard to this, as you'll see in a moment, but absolutely, just because you've had COVID-19 does not mean you do not need to be vaccinated vaccinated. How long natural immunity lasts is still unknown, and as you will see, how long vaccine immunity lasts is still unknown. We think that it will last quite some time, greater than a year for the vaccine. There are thoughts that natural immunity may wane after 3 months or more. However, antibody testing is not recommended for the purpose of vaccine decision-making at all. So do not go get an antibody test to determine if you should wait to get the vaccine at this time. What you should take into consideration is if you've had COVID-19, make sure you defer vaccination until you're clinically recovered and your isolation period is complete. This is twofold. One, we want to make sure you're recovered to the point that your immune system can handle getting the vaccine and actually build up the appropriate response to it and build additional antibodies that you may need. Second, we don't want you, if you are possibly still contagious, to further spread it to individuals who are getting the vaccine at the same location. So isolation and quarantine are still very important there. Again, we do believe that the natural antibodies you may get will last at least 90 days. So that feels like it's a very safe period to wait. Further, if you have received an antibody therapy as part of your treatment for an asymptomatic COVID-19 infection, these would include a plasma transfusion. These would include the monoclonal antibodies, also known as Regeneron and Bamlanivimab. Cannot say that one, my apologies. Any of those therapies, if you have received them, you need to wait 90 days. Again, this is because you could have competing antibodies and the vaccine may not be as effective. So those are the recommendations around whether or not you've already had COVID-19 and the vaccine. Let's talk a bit more about some special populations. What if I have underlying medical conditions? I have high blood pressure. I have autoimmune disease. I have a multitude of other things. For the most part, these are considered okay. There's no contraindication, if anything, and it's thought you should get that sooner than later because you're at higher risk of a severe COVID-19 infection. What if you're immunocompromised, such as having HIV? Again, this is thought to be okay. The major thing is that if you are severely immunocompromised, your body's ability to actually formulate antibodies may not be as good. So it will not harm you, but whether or not you will actually be protected by it is not as well known. So basically that means that there's a reduced immune response and that you very much still need to follow full precautions and be aware of that. What if you're pregnant or breastfeeding? At this point, there's recommendations directed at healthcare providers, but not directed at the general population. However, I don't see a huge difference here. The data is very limited. Again, looking at the mechanism of action, we do not see a risk of harm to either the mother or the child. However, the official recommendations are that the data is very limited and to weigh the risk versus benefit. Importantly, this is not a live vaccine, which is not recommended at the time of pregnancy. Again, this is not a live, so that is not an issue with regards to pregnancy with the COVID-19 vaccination. Having spoken to a few OBGYN doctors and individuals who are pregnant, it seems that most recommendations, at least for healthcare providers, are that the potential harm and risk from COVID-19 is greater than any potential risk of COVID-19 vaccine. And so most are recommending that, although it is your individual choice, of course, to proceed. So what about when should you absolutely not get it? There is very few times that this would apply. We've seen now reports of what is now considered a very rare side effect of anaphylaxis, meaning that you would stop breathing or have heart problems, very severe reaction directly from the vaccine. And this would ordinarily occur fairly immediately after receiving it. So that if you have a history of prior anaphylactic reaction, which is, as I said, a very severe allergic reaction to any other vaccine, that is a potential contraindication. I would still recommend you talk it through with your healthcare provider to decide for you. Overall, if you've had a history of other severe allergic reactions to foods, to antibiotics, those are not thought to be absolute contraindications to this vaccine. Rather, just plan to be observed for at least 30 minutes and take that into account when you decide to have this. just so you know, everyone is recommended to be observed for at least 15 minutes, which is another logistical concern when rolling out this vaccine, that unlike testing where we have very rapid drive-through, although drive-throughs are actively being planned and used for vaccination, individuals will need to be able to be somehow observed, accompanied, or stay parked for 15 minutes, at least at this time, in order to receive it via that mechanism. So did I get it? Yes, I feel very fortunate. I was able to get this as a surgeon at Sonoma Valley Hospital. And that is Becky, one of our surgical care nurses who has volunteered to assist in this process. And she gave me my first dose on the 21st of December. And I'll just tell you briefly, my experience with that is I had very minor, I was paying attention because I wanted to be able to tell you all about it. I felt that basically somebody had maybe lightly punched me in the arm, and that lasted less than 10 minutes. By the time my 15-minute wait was up, I honestly couldn't feel it. I kept checking for the next few days and I didn't notice anything. My normal reaction to the flu is that my arm feels sore fairly immediately and that lasts for 2 to 3 days. Sometimes I feel some fatigue with the flu reaction. I didn't feel any of that with this and did really well. I received my second dose yesterday morning. I actually did not feel that dose go in and was very surprised. I did not notice anything until late yesterday evening when I noticed again a feeling of somebody had maybe punched me in the arm and some minor soreness with the use of that muscle, nothing at rest and no difficulty sleeping. I've had absolutely no fatigue, fevers, overall joint soreness, or any other side effects at this time. So that is my personal experience, and I'll talk a little bit about other anecdotal experiences in a moment. So let's talk about where we're at in getting this out to you. I know this is a huge question we all have. And to understand that, I'd like to go through how this process works. The EUA, or Emergency Use Authorization, which is the FDA giving the okay to use this vaccine, that was approved for Pfizer first, and that was in early December 2020. At that point, the government starts allocating the doses that they have bought to the states. California, then, it's different from state to state how this is done, so I'll just speak to the California experience. California then allocates it to their counties via their Department of Public Health locally, or in some instances, as we'll talk about, to what are known as multi-county entities. For the very first distribution, I mean the day one, everybody got their distribution from their county. Subsequently, multi-county entities get their distributions directly from the state, where non-multi-county entities have to go through their county. And you'll see why that adds to our challenges for Sonoma Valley Hospital as I go forward. So the county allocates to these approved vaccination sites. And how do you get approved to be a vaccination site? There is a system that is called CalReady, and it was put forth by the California Department of Public Health, and it's transitioning to something called CalVax. Initially, invitations were sent only to acute care hospitals, and we were allowed to register after learning that we could actually comply with all the regulations and the storage and the shipment and knew how to do this and watch for side effects, etc. Once we could demonstrate we met all those requirements, we were given approval to proceed. And that is the process that anyone has to go through to be a site to deliver this still. They did open that up to non-acute care hospitals within the last few weeks, but from my understanding, that has been a slow process to get any others enrolled. So further, the shipments first began the week of December 14th for Pfizer and a week later for Moderna. Sonoma County, let's talk a little bit more. Our first shipment arrived on the 17th of December, and that was 4,800 doses of Pfizer, and that was for all of Sonoma County. And that was distributed between hospitals such as Sonoma Valley Hospital, Petaluma Valley Hospital, Memorial, so the St. Joe's system I'm referring to, as well as the Sutter in Santa Rosa and Kaiser, as well as Healdsburg. And I believe some doses were also given to the acute psychiatric hospitals. So this was a relatively small dose for a lot of individuals. Rapidly, other doses have come through. And let's talk a little bit more specifically about how Sonoma County is doing. So there's a website through the Sonoma County Department of Public Health that talks about the distribution phases. I updated this morning, but you can see they last updated it as of January 6th. And this is what is changing rapidly, but the best up-to-date site for Sonoma County local distribution. And I'll talk a little bit about what's currently in each of these phases and the plans and logistics around them. But we are somewhere in the middle of phase 1A, and I'll talk about what that is next currently, according to our county's data on what has been given so far and who still needs to get it. So what all is in phase 1 versus phase 2? Phase 1 began December 18th after those shipments arrived on the 17th. This was initially for phase 1A, which was healthcare personnel at risk of exposure, residents of skilled nursing facilities and similar settings. We have subsequently, in most areas, including Sonoma County, the pharmacies have gotten involved with a contract from the state, and they are administering those doses to such things as skilled nursing facilities at this time. Phase B was initially defined as essential workers and persons 65 years of age or older. Phase 1C, I think this all may change in the near future based on announcements that came out today, but currently is written as persons 50 to 64 years of age or 16 to 64 with specific underlying health conditions, as well as further at-risk essential workers. And in Sonoma County, that phase 1 is thought to be approximately 19,000 individuals. Phase 2 is not expected to launch for quite some time, as when we break down the phase 1s, you'll see what is involved in that. That is the remainder of anybody, obviously, who has not yet been vaccinated, as well as more to what we think of when we talk about the general population. So let's look at this in a little more detail. Tier 1, it says we are here according to their website. I would actually say we are now treating, after regulations changed last week, all tiers in phase 1A. So anyone who meets us, basically you need to be some sort of healthcare provider. You may be the actual physician, you may be a mental health provider, you may be an in-home worker, you may work at a skilled facility, you may be at a pharmacy, a dentist, a laboratory worker, you may be the janitor who cleans those facilities. All of those people are currently eligible, and that is the phase that Sonoma County is still in. On Friday, the state announced that the areas that had finished phase 1A could move on to phase 1B. So that is another gray area, but at this time, Sonoma County officially has not finished phase 1A. So from a county perspective, we are still working on these individuals, and then we'll rapidly move on to phase 1B as this is completed. So let's talk a little bit more detail. What happens next. The phase 1B populations, this is as it stood as of their website this morning. However, again, after some announcements from Health and Human Services on a national level that there's recommendations to go with everyone 65 and older, I do not yet know if CDPH and Sonoma County will be adopting those, but I am aware that those recommendations have come out as of this morning. So as of now, it stands that the next tier would primarily be 75 years of older and persons at risk of exposure in education, childcare, emergency service, and food and agriculture. And then you can see the rest coming down from there. Whether or not this will change, as I said, I do not know, but that is where it stands as of today. And for Sonoma County specifically, unfortunately, we're still on the phase 1A and rapidly working to get to the others. So Sonoma Valley Hospital, before I go into a little bit more about what I know about further allocations, is our very first allocation for perspective was 135 doses. So of that 4,800, we were given 135. We administered those over 2 days, that Monday and Tuesday. We were able to get another allocation the subsequent week, and that was another 200 doses. And then this week, we have been given another 200 doses that will be administered on Wednesday and Thursday of this week. In addition, we started our first, as you know with mine, round of second dose vaccinations, and those are separate allocations. I'm only speaking of first round at this time period. We've been told that we do not need to budget or divide our doses in half in order to hold back for the second round. The state and county are doing that on our behalf. So they will be available 3 or 4 weeks later, depending if it's Pfizer or Moderna, depending. Our first and second allocations were Pfizer. Our third allocation is Moderna. Sonoma Valley Hospital does not have an ultra-cold freezer, so those are graciously being stored as far as our Pfizer doses centrally in the county through Memorial, and we're grateful for that. Moderna is also being stored initially centrally in the county, but we do have the ability to store that on site if given an allocation to do so. As I said, we had 5 days to administer this entire allocation due to the requirements, because when it's at Sonoma Valley Hospital, it's brought up to refrigeration temperature. And we have 2 hours to use each vial once it's open. So we have to give 5 doses of a Pfizer vaccine within 2 hours for each vial. If we have the Moderna, as we have later this week, we'll have to give 10 doses within 1 hour. So how was it tolerated with Sonoma Valley Hospital? I'm sorry. Very well. We have not kept an official log, but we do have to report any major reactions, and we have not yet had to do that. There has been some injection site soreness, redness, whatnot. I'm not aware of anybody who has had a fever allergic reaction to the first dose. We just began second doses yesterday, as I said, so I do not yet have data on that. There is some thought that the reactions will be a little more significant with the second dose, as I experienced with very mild arm soreness after the second and none essentially after the first. But overall, this is exactly what has been expected. We have had no incidents of severe reactions or anaphylaxis requiring any treatments in our small experience. And overall, from what we're seeing from the few million who have been administered the vaccine nationwide, the incidence of anaphylaxis is very, very low. So overall, this has been very, very well tolerated. So before I move on to talk about what happens about life after the vaccine, I just want to touch on a few updates that I've received regarding further distribution. So first, I want to try to explain a little bit of the challenges we're looking at and why you're seeing differences between Kaiser's and Sutter's and Sonoma Valley hospitals. Why aren't we all doing it the same? What I hope is you've kind of seen through this, it's up to county by county, so there will be county variation, except for those entities that are multi-county entities, which are your Kaisers, which are your Sutters, in which they are ordered directly from the state. Further, any of those entities that have a primary care population assigned to them, meaning that your primary care physician is associated directly with one of those entities, it is thought that for the most part, they will be able to look through their records and contact their members or individuals who fall into the category of vaccination that they're on and notify them and vaccinate them. So it will be per PCP partially for those organizations. In addition, now the state, as of this morning, has announced multiple sites that they're setting up for large-scale vaccinations. There's an area in Sacramento, there Disneyland is being assigned, the Dodger Stadium is being assigned. I hear some local places in the Bay Area are, however, the ones in the Bay Area, I was told, are still in phase 1A and unknown date for when they would be moving to phase 1B. In addition, for Sonoma County, I learned verbally this morning that there are talks to start a mass vaccination site with the county in a partnership possibly with Safeway, beginning as early as next week using the fairgrounds in Santa Rosa. I do not have further details on that, but of course, as we learn them, we will post them on our website and publicize them. I'm also told there are talks for mass vaccination sites in Petaluma as well as Windsor. There are no planned at this time in the town of Sonoma that I am aware of. That being said, Sonoma Valley Hospital is actively working with our community partners, including the city, the fire, the community health center, and we're all putting our heads together to figure out how we can do this more locally in Sonoma. And I hope to have more news on that by early next week, which is the soonest we would be able to move on out of phase 1A. With this, however, remember each of these entities has a process where they must request an allocation from the county. So ultimately, these individual entities will be giving an allocation of doses from the county, and that will determine how many people they can vaccinate at any given time. And it is likely that we will be also given further guidance as to which populations to reach out to. So there's a lot of details in play here, let alone the scheduling and how that will occur, as well as the volunteers that will be needed to assist in this process and the monitoring that goes with it. There are legislation that's opening up that dentists may also participate after doing some education around giving vaccines. So hopefully that will increase the volunteer pool, but a lot of these details are still in development. So that is what I know as far as that as of today. So further, what about after I'm vaccinated? What do I do? Can I take my mask off? Can I travel? Can I do all this other stuff? The answer is not now, unfortunately. I wish it was an immunity card that we could all run free, but we're not quite there. So for now, we must continue to wear a mask, we must wash our hands, and we must keep our distance. When will we be able to do that wonderful freeness of getting rid of our masks at least? Well, that won't happen really until we can reach herd immunity. And that number has been rising over time as far as the estimates. We reach herd immunity when likely 70% or possibly more of our entire population has either been vaccinated or have natural immunity through having had the actual disease. Time estimates for this are largely somewhere in the summer of 2021. So that is where we're at with that. And why is that? Why can't you have an immunity card? Well, the best way to describe it is two factors. One, remember, these are thought to be 95% efficacious, meaning they work 95% of the time. The reverse of that, unfortunately, is they don't work 5% of the time. So it's very possible to give it. If you're out and about with the record high numbers that we're seeing in our communities right now, and you multiply that by that 5% chance, that's a pretty big chance that you could get it based on exposures. So not until our community members are come down significantly will we really see the effects of this vaccine working, and that effect of that 5% that it doesn't work for really not be relevant. So eventually, yes, this is amazing. This is much more than we hoped for when we were looking for initial vaccines as far as how well it works. It will get us there, and there's no thoughts that it does not work on the variants that we have seen now in the US, but originally in Britain and Africa. However, that is another possibility, that if there was a significant spike protein mutation, that adjustments would have to be made to our vaccine, but we are not yet seeing that as a concern. So before we open this up to further question and answers, I just want to make sure along those lines, all are aware of something the state of California has put together, which is called the Cal Notify app. This is an app that can go on your smartphone, works with both iPhones and Windows-based. It is designed to quickly notify individuals when they've been in sustained contact with someone who tested positive for COVID-19. Importantly, it does not violate your privacy, and that it does not collect device location to detect exposure, and it does not share your identity. It is confidential. You can opt into it in your settings. It uses Bluetooth. So basically, if your phone has registered that it's been in Bluetooth contact with another phone that is registered, and that individual has been diagnosed with confirmed COVID-19, which is reportable, then it can basically ping you and give you instructions on what to do. So if you'd like more details on that, we will give you the website to sign up here. So calnotify.cal.gov. And I think that if the more people who opt into this, the better this will work. It was trialed in Southern California for several months before it was rolled out statewide, and appears to work quite well and very safely. So in order to get our community numbers down and make these vaccines really work the way that we hope they can, it's important that we all do our part with that. So with that, again, thank you for taking the time to be with us today, and I will continue on behalf of the hospital to share information as it comes to us. We will continue to post information on our website and likely have additional webinars as more details come with community vaccinations in the future. Thank you.
Well, thank you, Dr. Kidd, and I appreciate everyone that is still with us. We are going to go through some of the questions. We've received several from through Dr. Kidd's presentation. So let's start out with one right now. We have some, and I'm going to be going back and forth between the Q&A section and the chat. So from the chat platform, the question is, how long do the antibodies last?
We do not yet know that. Thoughts are that they last well over a year for the vaccine and less time for natural infection. That's actively being studied, and the original participants in the studies will be monitored for levels, although decreasing antibody levels are normal and not necessarily do not mean that it would not be effective. They would build up if you were infected. So that is being researched, but there's no indication that we would need this repeated at least within a year, and there's much indication that it could last several years.
Thank you, Dr. Kidd. I have another one from the chat that I'm going to share or ask of you. Will this affect a young woman from getting pregnant? Do you know if it makes one sterile?
It has nothing to do with sterility. There's absolutely no mechanism action for that, and it should not impact one's ability to get pregnant whatsoever.
So from the Q&A platform, Dr. Kidd, we're being asked, how will we be contacted when our phase tier is up?
We do not yet know. I can tell you the options that I am aware of at this time, but those are the things that are still in development for the state of California, who it does not have one unified plan at this time. If you are a Kaiser member, I believe Kaiser will notify you directly when basically your time comes up. If you are a Sutter member, I believe they will also notify you, or if you are assigned to a primary care within their system and they have the ability to do that. If you are not one of those systems, your system may notify you if they have the ability to do that, but it is not a guarantee. Further, if you are in a workplace that falls into the category, your workplace will likely notify you that they have made arrangements with the county or that your number has come up and to go to a public site together. So an employer is another mechanism that you may be getting this. It looks like there will be increasing amount of public sites as well, where you may be able to sign up online or through a phone number, and that information is still lacking, but those areas that I'm discussing now, such as the large stadiums and convention centers and whatnot that are now being used for this, it looks like as there will be some sort of public sign-up mechanism. Again, it's important to keep our distance, so these can't be free-for-alls. We want to not make them COVID spreading sites. Instead, we want to vaccinate only, and we do need to be able to monitor individuals and address any immediate allergic reactions. So that is what's looking at that. For those sites, I believe continuing to watch our website, continuing to watch the news, continuing to watch the Sonoma County website for further information are all very important, as a lot of these details will be developed over the next few weeks.
Thank you, Dr. Kidd. I just want to give everybody in the audience, our viewers, a side note. Our website, sonomavalleyhospital.org, does maintain information related to COVID, and you can find the COVID site for SoCo Emergency that is going to explain about the vaccine. This is accessible 24/7. Also want people to know that we are in the process of setting up a hotline that's going to be specific to some basic information that Dr. Kidd covered today. That will be available through the hotline. More information will be available later in the week. We're hoping to get this to go live by early next week. Dr. Kidd, another question that has come up. Will we have to show documentation of any kind to get the vaccine? For example, a letter from our doctor saying what phases we're eligible for, or do we self-report?
It may be a combination of both, depending on where you're getting it and what they do with the phases going forward. So if it becomes that the medical indications are eliminated, then no, that wouldn't be necessary. Otherwise, the thought is with those that your primary care provider would know, and if you're to an assigned system, you would be called up based on that. If you're in an unassigned system, you would likely be asked for a letter or an order from your doctor stating that you meet the tiered requirements. If it is simply an age requirement, yes, you will likely be asked for ID that simply states your age, your birth date. If it is a work that related, that you're in education, that you're in another tier that is an essential worker, you will actually likely be asked for some type of proof that you work in such as organization. Again, that has not been standardized, and at this point, it looks as that may be somewhat up to the actual individual vaccination sites. However, I anticipate further guidance will come as we move into phase 1B and beyond in the near future. But at this point, we do not have official CDPH guidance on that.
Thank you so much, Dr. Kidd. Another question, it's kind of two questions in one. So if I've had COVID, can I still take the vaccine? And once I've been vaccinated, can I still transmit this to other people?
So yes, if you've had COVID, you definitely need to be vaccinated. As I mentioned, you may want to wait up to 90 days until you have fully recovered from COVID-19. If it has been more than 90 days, there's absolutely no reason to wait. When your number goes up, please go ahead and get the vaccine. If you've received antibody therapy as part of your treatment for COVID-19, you will need to wait 90 days from that time in order to receive the vaccine. And you do need to fully recover and be out of isolation before you receive the vaccine as well.
Thank you. I have a question regarding a reaction. So they're asking, I have shellfish allergies. Should I still get the vaccine?
Shellfish allergies are not thought to be an immediate problem with this. You would be monitored. We don't have a lot of specific data, but they are not at this time considered a contraindication.
So another question's coming up, and they're wondering, do people on biological infusions have to have a 2-week wait after receiving the vaccine?
That would determine on the type of infusion you're receiving. I would ask that you speak with the doctor prescribing that specific infusion. It's from one to another. There may be a reason to wait if they think that it would make the vaccine less effective, but it would again determine on the base of the infusion and the medication involved. So check with your with the physician that is administering or ordering that medication for you.
So Dr. Kidd, we're also being asked, can you elaborate a little bit more on the efficacy for those 65 and older?
As far as we know, the efficacy stands up similar to that 95 because it was a mixed pool in the subsets. It is possible that the overall it might be slightly lower, but is still thought to be very, very effective. So we do not have a concern that this vaccine does not work for older adults. However, can you transmit it after being vaccinated? Could you be infected? Theoretically, yes, and we are still gathering data on that. It is possible that you could be asymptomatic and your body be fighting it off, but still have a small viral load that you could transmit to somebody else who is not vaccinated and make them sick. That is why we very much must adhere to mask wearing until we reach herd immunity.
Oh my gosh, thank you so much for that. I'm also being asked, how do essential healthcare personnel who do not work for a hospital get vaccinated? The example here, go on.
If you meet the phase 1A requirements, there's a variety of different mechanisms. In Sonoma County, the Sonoma County Medical Association has set up a few different days in order to vaccinate physicians and others who fall into those categories. Sonoma itself, a large portion of who we vaccinated over the last few weeks have been community members, and we are continuing to do that. That is the 200 additional we have this week. And we are trying at this time to find out if there is additional need for Sonoma Valley Hospital to do additional phase 1A from the community that we are not yet aware of. So we're trying to collect that data. On the whole, if you're an independent practitioner, check with your larger society that you're part of, and or check with your any local area that you know is currently administering the vaccine. And if you are confirmed in phase 1A, if you are beyond phase 1A and not directly part of a center or somebody who else has notified you, I would encourage you to wait a week or two, as most phase 1B, it does not look like we'll start in the Bay Area till later in January or early February.
Thank you, Dr. Kidd. Again, a couple more questions. I'm seeing several of these about reactions. So one viewer is saying, I am allergic to penicillin in any form. I break out in a rash. Is the vaccine going to be okay?
As far as we know, yes, that is not a contraindication. Allergies to antibiotics and other known medications are not thought to be a cross-reaction. This is an mRNA vaccine, different components, different mechanism of action, not thought to have cross-reactivity at this time.
So someone's asking, so once I've received the injection, I've been inoculated, can I take Tylenol to deal with pain and soreness right afterwards?
Absolutely. We are even in some cases, if you have a history of severe reactions, you should discuss this with your healthcare provider, but consider taking Tylenol or even Benadryl ahead of time if that is what they advise. And certainly you can take those medications afterwards for any mild reactions.
So I can take this one, Dr. Kidd. We're being asked if we can obtain a copy of your presentation, and the answer is yes. We're going to be posting by the end of the week a downloadable version of Dr. Kidd's presentation today, both in English and in Spanish. And we are also hoping to post by the end of the week at our YouTube channel and share links across our platforms with how you can access and see the presentation recording, both in English and in Spanish. I would like to also add another question that has come in, that how do essential healthcare, I learned this morning that vaccination is voluntary for hospital staff. And in fact, a large portion of nurses may have refused to get it. Will the hospital have a policy that all those administering the vaccine have to be vaccinated?
So at this time, the emergency use authorization means that this has not yet had full FDA approval. Ethical principles guide us that this must be a choice and not mandated until it has full FDA approval. At that time, I anticipate it will be similar to the recent health order that came from our county and many like counties, that all healthcare providers must be vaccinated for flu. And I anticipate that will eventually apply to COVID once it has full FDA approval beyond the current EUA. We are not there, and I do not yet know the time frame for it. For at this point, it is absolutely a choice. We're highly encouraged. There will be declinations allowed, as must be by law, for medical contraindications, and I believe religious objections as well are allowed under that law. So Sonoma Valley Hospital will be following suit with whatever health orders come our way and enforcing them likewise. We are currently working through declinations, which actually are decreasing. I don't have a final number that I could quote you at this time, as we have ongoing vaccinations this week with some of those individuals. There were quite a few who weren't really ready to get it day one, but very much now that, several of us have gone through it and done well with 1 and 2 doses, are ready to get on board. And I am really hoping that that will continue to be the case, that we can show and demonstrate that this is a very, very safe vaccine that can protect us all and in this pandemic. So we're trying to get the word out to have everybody understand and be able to make that informed choice for themselves. But yes, I do anticipate that at some point this will be considered mandatory with those exemptions for all healthcare providers and likely many other sectors as well.
Thank you very much. We are being asked, if someone has one of the comorbidity conditions, will they need a note from their doctor to receive the vaccine if they are under the age of 65?
We do not yet know. When you make your appointment, that information will be given to you depending on the organization that is administering that. So look for such instructions when you are making your appointment. You will also at that time be given fact sheets related to the vaccine. You will be asked to sign consents, etc. So look for that type of information as far as what is required, depending on the site you go to get your vaccination.
So here we have an individual here in the community that's asking, so their wife was vaccinated, received the first dose last week as a mental health care worker in nursing homes. They're saying that they are not yet eligible to be vaccinated, but they're wondering, are they at an elevated risk of asymptomatic transmission from her until they are vaccinated?
I would not think so unless you change your protocols. Your risk of transmission actually would be less than before they were vaccinated. However, we don't have, as I said, we do believe it is theoretically possible that a vaccinated individual could still transmit to a low degree for a very short period of time. So there is that risk. Is it higher than prior to vaccination? Absolutely not, quite the opposite. But is it still theoretically possible? Yes. Has it been documented? No.
Thank you very much, Dr. Kidd. It's a common question that's being asked by a couple of people, that is notification. So if it is a multi-county, the likelihood of them being notified by their physician is going to happen. But there's a group of people that's saying, I don't have a primary care physician. How am I going to learn?
Well, first off, I'd encourage you to get your primary care physician in this time, because that may be part of the answer. Beyond that, you're going to have to continue to check websites such as ours and the Sonoma County website to look for opportunities for, quote, unassigned individuals to receive their vaccination when their tier is being vaccinated or after. So I wish I had answers to that, but it's very much, as you can see, a complex process still in development. And we are still, unfortunately, still doing healthcare workers of phase 1A. So once we get beyond that, which I anticipate having the next week, a lot more information is going to come out. As I said, I believe there will be some relatively public sites opening as soon as next week, even in Sonoma County, and please check their website as well as ours for those details to emerge over the next several days to weeks.
Thank you very much, Dr. Kidd. So there is a point of clarification that's being asked. They are asking, do I understand you to say that the vaccine is less effective in older people than younger people?
I don't have data to support that. We believe it works relatively equally, but more data will be gathered with increasing number of individuals in each category to determine that. But the 95% is all comers, but as we noted, greater than 25% of those individuals who are vaccinated were greater than 65. So it did not seemingly skew the data. So I don't believe so, but we do not have, I would say, conclusive data on that. It is effective. Is it slightly less or more? I can't conclusively say at this time. We believe it's very valuable to get.
So again, to participants and viewers, because there are a lot more questions are coming up. If you are a UCSF patient, if you are a Marin Health patient, if you are a Sutter, if you are a Kaiser, will you be notified? Dr. Kidd, can you go back?
I wish I could speak to all of theirs, and I can't. It seems to be still being delineated by each of those organizations, and the plans vary. I would encourage all, I know it's difficult, but to wait a week or two until more is known, as it seems most people are not able to provide concrete answers at this time. I do believe that most systems that are able and will be going through a process of notifying their individuals as they start vaccinating. I believe Kaiser is sending out such notifications. I believe Sutter will as well. I'm not clear on UCSF's plans, although we are affiliated, we are in separate counties and not considered a multi-county entity for the vaccine distribution process. So the Sonoma Valley Hospital process will follow that of our county and local, and the UCSF will follow San Francisco County and their own distribution process. San Francisco has fewer, as far as UCSF, primary care patients associated with it, being largely a tertiary and quaternary care center. So I'm not sure what role they will play in notifying patients who may have a primary care elsewhere. I know they are also committed to figuring this out, but I don't know the final plan for that. It is likely they will also assist and participate in community-wide vaccinations as well as Sonoma Valley Hospital. So I think within the next 2 weeks, this will start to become clear, but right now there remain a lot of questions as far as notification is concerned across the board.
Great, thank you so much. We have time for a couple more questions. Hang in there with me, Dr. Kidd. I'm getting a lot of questions about, are there drugs that people are currently taking that might reduce the efficacy of the vaccine? For example, this viewer is on prednisone, and they read somewhere that being on this can influence the effectiveness on the vaccine. Is this true, or are there other drugs that work against the vaccine?
I would check with the physician who prescribes your prednisone. It depends on the underlying condition that it's treating, the duration and the dose involved. So again, in theory, does that reduce your body's ability to mount an immune reaction? It can, but there's many variables with some of these medications such as prednisone. It is not across the board a warning, but again, if you have a specific concern, check with the doctor prescribing that medication for you and your circumstances to speak about the timing and the risk and benefits about proceeding as soon as possible or delaying for a therapy to be completed if possible.
So a follow-up question to that, I'm being asked, what steps have been taken to educate the local medical groups who are disconnected from the information that we're providing?
So I know that Sonoma Valley Hospital, did a webinar with our local internal group a few weeks ago. That's one efforts we're doing. Also working with the local offices. We work with an organization called Meritage Medical Network, which is also reaching out to independent practices to help with education about how this goes. There's quite a bit of information available on the CDC website and publicly that each individual office, as part of the routine practice, will be checking. Whether or not individual offices will become distribution sites will be up to those individual offices and is a bit unknown. I will say from a logistics standpoint, it seems quite complicated for a small primary care office to allocate and be able to use the vaccines in the way that we would see is the most useful, meaning that having the logistics behind the storage and the quick administration batches are very challenging to a primary care office. And so I can't speak to how many will be able to get that directly, but they may be able to refer to a larger vaccination clinic or pool resources. And I anticipate more of that coming forth in the next few weeks.
Thank you, Dr. Kidd. So a couple more questions we still have time for. So being asked more about the vaccine itself. What is the mechanism for how the vaccine targets cells that then die as a result of exposure to the vaccine?
So it's the spike protein that's on a coronavirus is what is mimicked, and our body is trained to attack that spike protein. And so any spike protein that enters our bodies will know to either attack it. So an antibody can basically act as neutralizing it, attaches to that spike protein and prevents it from then attaching to an otherwise healthy cell. Or there's other cells that if our cells have been infected by it, they will recognize it and destroy any cell that contains a spike protein. So there's multiple immune ways that happen. And this is just our immune system doing its job. This is what we train our immune systems to do. Virtually what happens, we hope with a natural infection, but can take quite a time to fight it off. This happens immediately because our body isn't learning how to fight it off in the process of being sick. This prevents it by learning it before you ever become sick and your body's resources are being used up fighting that illness. So that's the difference between acquiring this naturally versus via vaccine. The vaccine has no way to make you sick on a long-term basis with COVID-19. You may have side effects, which just mean your immune system is working and doing its job to prepare to prevent COVID-19 in case it encountered it, but that's not the same as being ill with COVID-19.
Okay, we're going to wrap this up with four questions. I think it's going to be a quick response. People are wanting to know, when we get the vaccine, are we going to get a card that we can show if we're traveling or having to prove that we've been vaccinated?
Absolutely. This is one of the things that it was very done well, shall we celebrate, is that in the distribution process, accompanying the vaccines are a couple items. One, the needles and supplies needed to administer them are largely given with it, as well as cards. And these little cards are from the CDC. They're standardized. You've probably seen pictures of them on Facebook and whatnot. And they are where you record the doses and the details of each allotment and the type. You'll need that for your second dose. In many cases, in order to get your second dose, you'll need to bring your card because it has to be written on there. And that will be your proof that you're doing it within the correct window of the 3 to 4 weeks. So yes, those are part of the process, and you will receive your card with your first vaccination. And please, I have mine in my wallet. I would keep it in a trusted location such as that and keep it with you. How those will be used in the future, I don't know, but it's definitely important to have it with you.
So we are also being asked, what type of vaccines has the hospital been administering?
To date, it's been Pfizer. However, the 200 new allocations, meaning first dose, that will be given later this week will be Moderna.
Okay, I'm being asked a really interesting question. Does Sonoma Valley Hospital have monoclonal antibody treatments available, so avoid needing further hospitalization?
We do. Again, these are the therapies for someone who has been diagnosed with COVID-19, confirmed laboratory, within the first 10 days, preferably the first 3 days, is high risk as defined by those drugs authorizations, but not yet needing hospitalization. So it's a bit of a narrow window of who is eligible. If you meet those criteria, please check with your primary care and they can order that. That is an infusion that takes approximately 3 hours for the whole ordeal, is given at Sonoma Valley Hospital via IV. As I said, it is an infusion and your primary care provider can order that. If they do not have the information to order it, please have them reach out to Sonoma Valley Hospital and we can forward that. But it has been sent to all local Sonoma Valley Hospital or Sonoma Valley local primary care practitioners as well as the health clinic. And they are using it with some regularity.
Well, that was a lot of information that we covered in a short period of time. I hope this has been useful to everyone in the community. I do want to say that there are websites that you can check. Of course, there is the hospital's website. We have a portal that's dedicated on information related to COVID-19, both testing and vaccines and other information that's needed. That website is sonomavalleyhospital.org. and you'll be able to see it once you arrive at that landing page. Another website that we encourage you to check out is put up by Sonoma County, and this is called socoemergency.org. Here you will find updated at least every week information, sometimes daily, sometimes each 12 hours, information about how COVID is impacting the county, testing sites, sidebar questions that people may have for interactions, as well as information about the vaccine. Again, that website is socoemergency.org. Other questions that you have and more information that you may need, please reach out to the hospital. You can email us directly by sending your note to community@sonomavalleyhospital.org. That's community@sonomavalleyhospital.org. And of course, you can call us, our community outreach group, directly at 707-935-5257. I do want to say that we've had lots of comments, Dr. Kidd, and a summary is it's very comforting to have someone like Dr. Kidd teaching us about the ins and outs of the vaccine. Thank you, thank you, thank you. This has been very, very informative. People are appreciating the presentation. Again, my goal is that by the end of the week, both in Spanish and in English, the presentation will be available, as well as Spanish and English, a record of this actual live session. I want to thank everyone, in particular to Julie Burns, our interpreter, and Danielle Tamayo, who interpreted for us in the Spanish simulcast. Very grateful for their time of attention. And of course, to Dr. Kidd, thank you so much for being so gracious with your time and answering these questions. If we missed a question and it has not been answered, please send us an email or give us a call. That email address again is community@sonomavalleyhospital.org. And that phone number is 707-935-5257. I want to thank everybody for being here today's session, and please, we will be doing everything we can to keep everybody apprised. We want to keep it so that you know what you need to know before it gets too out of hand. So again, thank you very much. Thank you, Dr. Kidd.
Thank you, Celia. Thank you all for being here.